Hey docs, this is Dr. Kelly Henry with KP Henry Consulting. This is the third video in a series of 3 about what I can't stand about your office. If you watch the first 2 videos, the first one was about how your office is not particularly clean. Second video was about how your office staff or you may not be particularly friendly. And today's video, we're going to talk about how your office is kind of slow. As you know, we live in a very busy society. Every one of us is busy. We all have a bazillion things that we have to do on a daily basis. And this certainly includes your patients. So when a patient comes to your office and they need care, obviously, and everybody needs chiropractic care, don't get me wrong, but when they need care, and especially the newer patients that may need multiple treatments per week, when they come to your office and have to wait 15-20 minutes to get back to a treatment room, and then they have to go through the treatment, which takes 15-20-30 minutes, and then you put them in therapy and that takes another 15-20-30 minutes. They're in your office an hour plus, and again, that's not necessarily wrong, but that's a fairly significant chunk out of a patient's day. Now, what I've seen in my office and offices and other clinics, one of the key items that slows the office down is idle chit chat from the doctor and from the CAs. Docs, when you're back with a patient and you're shooting the breeze with them about their vacation or about fishing or water skiing or about politics or religion, which I hope you don't ever talk about those, or about anything else that doesn't pertain to chiropractic, you're slowing your process down. You really need to focus in on the patient, their health, and communicate the chiropractic message. And that's really all you need to talk about. Same thing holds true for your CAs. If they're talking amongst themselves and talking about, what they had for lunch or what they did over the weekend or the new shampoo they're using and not focusing on getting patients through your office and being respectful of their time, or if a CA that's taking a patient to the treatment room or the therapy bay or room and they're standing there talking and shooting the breeze and not talking about chiropractic, that slows the efficiency of your office. So I encourage you docs to look at your office. I'm not asking you to change procedures, but look at what's going on, especially with the communication. Are you chit-chatting too much? Is your office staff chit-chatting too much? Are we focused on taking care of the patients and being respectful of their time and getting them through the office as quickly as we can, but yet communicating the chiropractic message and helping them get healthier? I encourage you to look at that, change things as needed. I guarantee you it'll help your patients. It'll help you create a time for more patients, and your patients will appreciate it. Again, this is Dr. Kelly, KP Henry Consulting. Hey, if you're a doc that may be struggling in practice, or maybe you've been in practice for several years, but you're just not doing as well as you would like to be, there's more that you can accomplish in your chiropractic career. Hey, go to my website, kphenryconsulting.com, and set up a consultation with me. And let's talk about your practice. Let's talk about how I can help you take your practice to the next level. I appreciate you watching this video. I want you to have a fantastic day and keep being relentless.